Hello, everybody. It's Donna Cravata, and we're back with another Real 50 Over 50 interview. And today we have one of my favorite people, Dr. Jessica Drummond. She's a leading expert in functional nutrition, women's health, and integrative wellness, with over 25 years of experience as a clinician, coach, educator, and business owner. As the founder of the Integrative Women's Health Institute, she's dedicated to helping women navigate the complexities of perimenopause, menopause, and chronic health conditions such as endometriosis, long COVID, autoimmune diseases, hypermobility, POTS, MCAS, and metabolic disorders. She's a sought-after educator and speaker and has trained thousands of women's health and wellness professionals worldwide. She's the creator of the Women's Health Coach Specialist certification with programs in perimenopause, menopause, endometriosis, longevity, and more, and has empowered 3,500 graduates to bridge the gap between evidence-based lifestyle medicine and compassionate coaching. Welcome, Jessica. It's so nice to have you here today.
Thanks so much, Donna. It's my pleasure to be here.
And there's so much to talk about because we are in this age of, um, you know, deep in the heart of what people didn't tell us to expect.
Correct. Correct.
So,
Yeah.
what could people do? I mean, I speak to so many women that uh, didn't realize what their bodies were going through because, they tell us what to expect when you get your period, when you have sex for the first time, if you get a yeast infection, those types of things. They don't
hmm
tell you, they don't tell you what menopause is going to be.
It's so true. And I think the reality is the landscape in health and menopause, the kind of intersection between how women's health is suffering, quite honestly, and that time frame of perimenopause and menopause, both physiologically and just practically, is a really challenging time for multiple reasons. I keep telling my husband my next book is going to be called like Perimenopause in the Age of the Zombie Apocalypse because the reality is our health is actually declining to some extent. Women in this age group have, 80% or more have autoimmune diseases, underlying chronic illness. One of my colleagues, Dr. Marisa Snyder, says, you don't, I forget exactly how she words this, but the gist is, rarely do we arrive in perimenopause with a perfectly clean slate, right? Health wise, because we know that a lot of these issues that are amplified in perimenopause can even begin pre-pregnancy in our teens and 20s, things like PCOS, which is a very common issue for women, the number one cause of infertility, and that is polycystic ovarian syndrome. And that is actually on the metabolic spectrum. So when we have young girls in their teens and 20s and 30s dealing with metabolic dysfunction, prediabetes, PCOS, even PMDD is on that metabolic spectrum, which is a sort of extreme version of premenstrual syndrome with a lot of mental health symptoms. If you continue that disruption in our metabolic health all the way through perimenopause and postmenopause, that's why we see so many women having dementia and Alzheimer's and heart disease, which, and cancer. These inflammatory metabolic conditions are our number one killers later in life. So, what happens when you wake up in your 40s and you're like, okay, my health is not perfect and I'm in this menopausal transition? The problem is you might have even had your health pretty well under control, controlled with medications, controlled with supplements, even controlled with lifestyle. You might be one of the healthier people, that 20% healthy. Then you start to experience somewhat vague symptoms that
Mhm.
basically no one has explained to you. Things like hot flashes, which, we say hot flashes, but like you don't really know what that feels like. And suddenly you're just like, am I hot all the time? Am I cold? Am I just having heart palpitations? Is that a hot flash? Like, and these feel different for different people. Am
Mhm.
I dizzy? Am I dehydrated? Am I anxious? Am I depressed? And is any of this related to perimenopause? Well, the likely answer, no matter what it is yes. And we also don't want to start kind of going too far in the opposite direction where it's like, oh, whatever, that's just perimenopause. Because sometimes these are either warning signs or exacerbation signs of more complicated underlying chronic illnesses, everything from cardiovascular conditions to post-viral illness. One of the reasons I say, like in the zombie apocalypse, we know that you're 45% more likely to have long COVID or another post-viral illness if you are in the 40 to 55-year-old age group, and particularly if you're perimenopausal. It's
Mhm.
slightly less, it's like 43% if you're postmenopausal. And let's back up for 2 seconds and just talk about like what is perimenopause and what is postmenopause. So in perimenopause, you can think of it as like puberty in reverse. So think about puberty. You have a girl starting to have hormonal fluctuations that are a little bit all over the place. Estrogen's high one day, it's low another day. Progesterone's high one day, it's low another day. Testosterone starts to wake up. FSH, LH, and all of this becomes organized over a period of a few years to stimulate ovulation.
Mhm.
To stimulate ovulation, you have a rise in estrogen, a rise in LH and FSH that trigger the release of the egg. You have a smaller rise in testosterone that goes along with that to trigger sexual desire and sexual function. And then in the second half of the cycle, which is called the luteal phase, so that beginning half of the cycle is called ovulation, then follicular phase, no, sorry, menstruation. So it starts at day one of your period, day one of your bleed, and then a few days to a week or so of menstruation. Then the follicular phase, which are all the hormones increasing to trigger the release of an egg. And then that's ovulation. And then the luteal phase is a rise in progesterone to help that egg implant, if it's fertilized, and a decline in estrogen and testosterone. And then again, the cycle starts over with all of the hormones being low. So in puberty, it's all over the place for a few
Mhm.
years. Some years you're ovulating, some months you're ovulating, other months you're not ovulating. The same thing begins to happen in perimenopause in reverse. So you've been ovulating, ideally consistently, but again, if you've had endometriosis or PCOS or other issues, you may not have been ovulating perfectly every month. You may have been on hormonal birth control. You may have had multiple pregnancies. You may have been nursing for a while. But let's assume you maybe had one or two pregnancies. Everything was perfectly normal. You've restarted your cycle. Your cycle's been normal for years and years and years. And then, it starts to be a little weird. It's
Yeah.
too long. Sometimes that happens because the body tries to ovulate and it doesn't because you begin to lose quantity of eggs. And then it actually ovulates like 45 days in. And so you're like, where is my period? Women are like, I feel like I've been getting my period for 2 weeks now. That can happen. So you sometimes get a longer cycle. Sometimes you ovulate normally, but then for some reason the estrogen doesn't drop back down. So you have high estrogen, breast tenderness, pelvic pain, migraines for like 3 weeks when you used to only have them maybe one day during your cycle. And then sometimes the hormones just crash out and you get nothing for the whole month, or you get really high or really low estrogen day to day. So then you feel a little crazy or a little itchy, a little allergic, a little more pain, a little more yeast issues because it can change the microbiome of the gut and the vaginal areas, the vulvovaginal microbiome. So the thing that happens in perimenopause is that the hormone levels day to day are chaotic.
Yeah.
So you're not able to track what's going on with my symptoms and is it related to my hormones? Sometimes we can tease that out with a very detailed history and some tracking. And there are some new tools on the market, like the Mira, for example, where you can track your hormones from home day to day. Sometimes that's helpful. Sometimes you can track them in the office in different ways. But it's really the other challenge with perimenopause is for some women, it's like 3 to 5 years. For some women, it's 15 years. So that's a really uncomfortable amount of time to feel so all over the place.
But also it can be misdiagnosed or just
Mhm.
overlooked altogether because it could just be I'm having a bad day.
Well, and that's the thing. Like, when is it your chronic illness, or when is it triggering a chronic illness?
Mhm.
When is it perimenopause? And when is it just the normal range of like, some people just don't feel great 100% of the time. That's
Mhm.
normal. There's a normal range of that. And I think it becomes difficult to tease that out. So what you want to start looking for, and then just to finish that initial thought, menopause, the like definition is 1 year from the last period. So of course, if you had a hysterectomy or a partial hysterectomy, or you're on some various medications, you may not know exactly the
Mhm.
day that you're in menopause, or even if you just aren't tracking very closely. But roughly 1 year post cycle, whether it was surgical, medical, or kind of normal evolution of your lifespan, that's what we call menopause. And actually, some women begin to feel better whether or not they do anything with their hormones in menopause, because the hormones are low,
Yeah.
but they're more settled. They're not so all over the place.
Yeah. I had a uterine ablation when I was 42 because my periods had become really, really heavy.
Mm,
And so I never had the symptoms. And I don't know when I went into menopause.
yeah,
I
it's just
never,
hard to know.
yeah. I just,
Yeah.
yeah. And but I think like, I got AFib. That's what I got.
Yeah. Well, and so cardiac arrhythmias are increasing, and it's tricky. Arrhythmias in women are the more common heart issue compared to with men, it's atherosclerosis.
Mhm.
We both people, both men and women have both, but more commonly women struggle with arrhythmias. And now post viral illnesses, so again, whether it's COVID or even flu or Epstein-Barr, can trigger a dysautonomia. The most common is POTS, postural orthostatic tachycardia syndrome. So you may be experiencing tachycardia, but it's not, which is a high, fast heart rate, but it's not actually a heart issue. It's like a heart brain connection issue related to the fact that if you stand up and your heart goes faster, it's because your blood volume is changing such that you're not getting enough blood to the brain and enough
Mhm.
oxygen to the brain. So the brain's like, hey, speed that up.
Remember me.
Right. And there are lots of different causes of that. So, if, for example, you have a hypermobility syndrome like Ehlers-Danlos, it might be just because your vessels are getting floppier. Or if you have a mast cell activation syndrome, histamine makes the vessels more porous. So you might have plenty of fluid, but suddenly it's all in your hands or your feet. It's not in your vessels and going up to your heart or to your brain. So those are some really common things we are seeing now that I think were less common pre-COVID, quite frankly, but they did exist. And then we do have the heart damage that is being caused by infectious diseases such as COVID, which can actually trigger damage to the heart conductive system, the electricity system in the heart, which can trigger just pure arrhythmias. And then when you lose the support of estrogen, so I think a lot of the problem is that a lot of these things are happening at the same time. So, like, someone might have had cardiac stress from COVID in their 20s that took them a while to recover from, but they were able to fully recover within a matter of months. Whereas a woman who has the exact same experience in her 40s also has lost the metabolic support of estrogen. So you begin to have metabolic stress to the cardiovascular system as well. Estrogen is a really important hormone when it comes to insulin resistance and insulin sensitivity. And that's where, everyone's like, just eat less sugar, stop drinking alcohol, don't eat carbs. And that's helpful, but it's probably not going to solve that root problem in the context of very low or very unstable estrogen without whether it's estrogen support or medical support for the heart or both. So I think to some extent, the fact that there's so much education on perimenopause and menopause, in social media and things like that is valuable. But in these more complicated situations, like a triggering of AFib during perimenopause, just eating to optimize your blood sugar stability is often not going to be enough. And then we do need to do things like strength train, build muscle to help kind of eat up that extra blood sugar. But again, a person can't do that when they're in active cardiac arrhythmia. You could trigger a stroke or whatever. So I think this is where, if you're a woman who's in that perimenopause to menopause transition and you're feeling whether it's mental health symptoms, weight loss resistance, extreme fatigue. I've had a number of patients lately with a lot of extreme fatigue, which can also be post-viral related, but can also be related to the life that you're living in your 40s and 50s, empty
It's
nesting, there's a lot of stress. And again, you're something that some of the plates you might have been able to be spinning when you were in your early 30s, when you had all that juicy estrogen support, you begin to hit a wall physically. And then if one other thing happens, whether it's an acute stress or an illness or, an injury, a car accident, whatever, I think what we're seeing a lot of now is just so many things hitting at the same time at a vulnerable time in a woman's health. And so, what I think is so important is that, yes, the messaging around getting yourself in as good of condition as you can before and during you're in your 40s and your 50s, that's really, really helpful. But if you're already kind of halfway into that downward spiral rabbit hole, it's not enough.
mm.
And we have to kind of be really aggressive to get the health care we need.
And what do you recommend, like, people do when they're not getting the support that they need from their medical providers? Because, you know, we have what, 10 minutes
Yeah.
once a year?
I think this is really a challenge, but there are some practitioners out there who are, I think, really starting to wake up to this. Like I said, we've trained several thousand health coaches, particularly those who have either been in this field for some time and are really good at helping people kind of navigate the system and who you need on your team and helping you formulate what questions to ask them. Highly trained health coaches can be really valuable as almost like case management social worker, and to help you get really clear on what you want,
Mhm.
because we have different goals in our 40s. Some women want to, hike Mount Everest. Some women are like, okay, I just really need my brain because I really want to keep working and keep, hitting some career goals right now. And I feel like I can't remember where I put my keys, never mind give a presentation, right? So that's super common. So I think health coaches can be really valuable. Other people that can be really valuable are clinicians that have health coaching skills that can help listen to, like, what do you need? What's the order we need to do? How quickly can we make these changes? And they have clinical skills. So, women's health or pelvic health professional physical therapists often have a little more time to really listen. And then, if you do need hormone support, often they have the network where they can be like, okay, here's a gynecologist who's really going to listen to you. And let's, before you even have that appointment, let's formulate the questions you're going to ask. Because when it comes to physicians, they're the ones with the least amount of time and the first place that people often go. I actually think better to see a women's health PT, OT, nurse practitioner, PA, health coach, like an allied health or a professional that's more primary care, but really specialized in
Hmm.
women's perimenopausal care that is thinking about all of this overlap
Hmm.
and is then going to help you find the right person. So you may need to work with a gynecologist to get your hormones prescribed. You may need to work with a cardiologist to rule out certain sinister pathology. You may need to work with an endocrinologist and or clinical nutritionist. Clinical nutritionist is another great person, especially if they have coaching skills.
Hmm.
So there are a lot of really skilled health professionals who are not MDs who can actually help you get better care from your team of MDs.
Yeah, because doctors tend to um, just serve one body part, and
Mhm.
you're not going to find the solution because we're all connected.
Yeah. Yes. Especially in perimenopause because your shifts in hormones, like for example, the decline of progesterone. One of the things people really are bothered by initially is the lack of sleep.
Hmm.
And one of the main drivers in perimenopause for that is not actually estrogen, it's low progesterone.
Hmm.
So, supporting progesterone can be very helpful very quickly, but often it's not enough. It's
Yeah.
not just like this magic bullet. Because then, okay, so let's say progesterone really gives you some added support. Then we need to take a step back and be like, okay, this is where the coaching really comes in. How do we get here? Like, are you drinking alcohol at night? Are you staying up late? Is your rhythm off? Are you in front of screens all day and never outside during the day? Are you too fatigued to exercise? Or you have a heart condition that makes it hard to exercise? Or are you too brain foggy to really manage your evening wind down routine? Because you're just like, put me in front of Netflix, give me a bowl of popcorn. Like, I don't even want to cook dinner. I'm exhausted. We have to take a step back from that sort of relatively short term solution, which is a key part of the solution, but it's not the whole solution. And if we just add progesterone, you might sleep better, but you're not going to get to why your sleep is so disrupted in the first place.
Hmm.
And so then we can start putting routines in place because at least you're getting some sleep. You might be able to be like, okay, I'm going to take a 3-day weekend and just like catch up on some sleep enough that I can then sit with my coach and make a plan. Because I find that women really survive sometimes for years before they even ask for any help. And I think that the mental health symptoms, the same thing. Like we start to feel crazy. It's like I'm anxious, I'm depressed. Some days I feel totally fine, or I'm blackout fatigued. And then the next day, I like took my teenagers to a concert and I was okay. And it's like, I don't understand why I'm feeling so all over the place, both physically and mentally. That's where we really have to take a step back, figure out what else is going on, and then know. And here's, I think, a really important thing when you're having these conversations with your providers. If you're between the ages of 40 and 55, you're in perimenopause or
Hmm.
menopause. It's just where you are. It would be like if I had a 12-year-old who's starting to get moody, who maybe hadn't gotten her period yet, but is starting to have breast tenderness. Like she's in puberty.
Yeah,
And I think sometimes we're like, menopause doesn't start till the 50s. Menopause ends
in the
at
50s.
51 on
But but
average.
but
Yeah,
that's exactly part of the problem is that menopause is an end game and it's not an end game.
correct. And I do think that's another key piece of the puzzle. But if you're
Mhm.
40 to 55, you're in perimenopause if you're having a lot of this, even if you also have something else.
Mhm.
So we need to support all of it.
Yeah.
It's not just hormones, it's not just nutrition, it's not just
And it's
treatment
and
for
it's
your
shifting
heart.
sands, like it's different every single day.
Yeah, and that's why you need a person to really help you navigate this that has seen hundreds or thousands of cases. So we can understand like what is going on here.
Mhm.
Then post menopause, and this is really important. I have plenty of clients in their 60s. It doesn't just fix everything. Even in the world of endometriosis. So one of my earlier books was on endometriosis, and I've worked with patients with endometriosis forever. And it was like this, rule of thumb, endometriosis just goes away at menopause. It doesn't. That's
No, it just
absolutely
settles.
false. It might settle, or it might actually be triggered. You might have never had any endometriosis symptoms in your
Mm,
whole life, and then you have them at 48. Like it might be triggered by perimenopause.
yeah.
So in menopause, the other issue is that sometimes women are in their 60s and the doctor's just like, well, it's too late. There's nothing we can do. You've been in menopause for 10 years, 15 years. That's actually not true. It is better to have hormone supportive therapies, hormone replacement therapies earlier, like in kind of that perimenopause to menopause transition. Because don't forget, there's a lot of different hormones we're talking about here. It's not just estrogen, it's progesterone, estrogen, testosterone, sometimes oxytocin. We have to think about insulin and cortisol. So we want to thyroid, we want to look at the thyroid function. So we want to look at all of that. But if you're 60, 65, even 70, and you're like, I still don't feel better. I've been feeling horrible for 15 years. And they're like, well, it's too late now. Absolutely, it's not. First of all, there's so many foundational things we can do with nutrition, with exercise, also with getting treatment for some of the things that maybe didn't just magically go away with menopause. I have had more and more clients who have endometriosis excision surgery when they're, 52, 55. That's might be the thing you need. You might actually need treatment for your underlying issue. If you have mast cell activation or if you have dysautonomia, there are lifestyle and medical treatments for some of these issues. And I think it's an important time to kind of examine again, what are your core stressors? And it is not particularly quote unquote dangerous to also begin hormone therapies, particularly for people who are symptomatic.
Okay.
And so if someone is really struggling with weight loss resistance, or they still have hot flashes, or they have a lot of brain focus issues and it's really affecting their lives, while the data supports doing it earlier is more effective, there's a real cost benefit conversation to have about starting it later. Sometimes there's a slightly increased risk of things like cardiovascular issues or breast cancer. But depending on how much you're suffering and depending on your family history and depending on the other things that are going on for you, those risks may be far outweighed by the benefits that you can get from supportive therapies. And increasingly, we have these other tools like GLP-1 and GIP peptides. Um, you know, there's all kinds of therapies that are being accelerated for a lot of these different more chronic illnesses. There's a really great research arm at Mount Sinai Hospital looking at complex chronic illness. And while they've just kind of gotten started, this is one of the reasons that I actually am kind of excited about AI and some of the tools of data for more complicated chronic illnesses because they present differently in each person. And
Mm,
I've seen, again, tens of thousands of cases of this in the course of my 30-year career. So you begin to get pattern recognition but for your average practitioner who has 7 minutes, I think there could be a great benefit to starting to develop some of these tools using the new science that we
mhm.
have. So I think we've got a lot coming down the pike. Obviously, science in this country is kind of a mess right now. So that may be
Yeah.
slowed down, but there is still a lot of private funding. I mean, we can all be hopeful that like the infrastructure is strong enough to withstand some of these headwinds. But, you know, so if you're a person who's like, I have not felt well for a long time and I do not know where to begin. Step one, I think, is it's time to speak with an experienced person. Even 1 hour can help set you on the right course. Because what we do have access to right now is a lot of direct consumer medications, testing, supplements. Before you invest in a lot of that, I'm glad it's available in most cases, but it's not the place to start
Yeah.
because you don't know what you don't know yet. You don't know what you're dealing with. You know, if,
You
you know,
know
I
who's
saw somebody
selling
just,
it.
yeah, I saw somebody kind of almost posting today on social media, like almost like an MLM version of like a GLP-1 drug.
There's a lot of that.
That is dangerous to me. Now, utilizing a direct consumer telehealth company to write your prescription for literally whatever, I'm not necessarily opposed to that if you have a human helping manage your care and it
Mhm.
just makes the access to that tool better. But, is that tool of good quality? We've got to answer these questions. I really don't think you should be buying any of your medications in the same way you could buy like Tupperware or whatever.
That's a really good reference point.
Yeah.
And
Yeah.
you just don't know. I mean, you don't know. You see something on a Facebook ad or an Instagram ad. You don't know where that initiated from. You don't know if it's taken a left turn somewhere.
Right. And you just
Um,
don't know like who is running this company, what is their actual goal. Yeah. And the same thing with labs. Like you do not need 100 labs twice a year. you know, Yes. Are there some very useful, do I want most of my clients to understand their vitamin D level and their hemoglobin A1C level or their fasting insulin, things like that? Yes. But again, working with a person can help you focus
mhm.
what your body needs more awareness of rather than just collecting all this data. I've had people come to me with like really in-depth spreadsheets, which, that's useful up to a point, but it can actually be really anxiety provoking when you're like, well, this one's slightly off and this one's slightly off. And what does that mean?
And
And
then you start Googling each one of those things, and that never goes well.
right. Or even worse, I've had more and more people just stick it in Chat GPT.
Hmm.
And then they're like, then ChatGPT is like, take these 17 supplements. No, we've actually seen a significant increase in liver failure because
Oh,
people are taking so many supplements that have been recommended to them just roguely via Instagram ads or ChatGPT.
oh man, that's scary.
Yeah, even in young people, because
They have to be taking an enormous amount for that to happen.
I mean, yes and no. You don't need tons of turmeric to start having liver failure, and and it depends on how well it's absorbed. If they enhance the absorption with different ingredients, you can have vitamin D toxicity if it's over 100, 150. You can easily have vitamin A toxicity. Vitamin A toxicity was actually a huge problem when there was a little bit of a rumor that vitamin A could treat measles in those populations that were having measles outbreak. Vitamin A is actually fairly easy to overdose on in a very dangerous way. So, you know, it's not, you don't, for certain supplements and certain formulations, have to take a lot before it gets dangerous. And the other thing that people don't think about is increasingly people are taking like powders that have a whole lot of
All kinds of
stuff.
things, yeah.
And then they might also take another product that has that in it and another product that has that in it. And then they end up overdosing just because they're taking three products, but each of them has like the therapeutic dose of one ingredient.
Yeah. And then there's also like food interactions. I mean, sometimes food will interfere with, either a drug or a supplement that, and if you take too much of it, you're going to have this reaction in your body. And um, like, it's so scary. That's why
Yeah.
I don't like taking any kind of medication, but I have to. But, you know,
Well,
you really don't know what's going on under the surface.
and I think I've started to sort of reframe my thoughts around medications, supplements. None of them are, and I wouldn't even say this is a reframe. This is just an evolution of understanding of the fact that these are all tools. None of them are magic, and none of them are absolutely terrible. Chemotherapy, which has really rough side effects, is super valuable in certain circumstances.
Hmm.
Um, you know, Tylenol, which is really valuable for a few minor things, has a really high risk profile for liver damage. So, like taking it every day forever is not a good idea.
Yeah.
Um, all of these things are tools, and that's why I think direct consumer focused brands that are very marketing heavy, and especially brands that'll do like, here's all your tests, now here's all the supplements you need,
Hmm.
are missing a really important intermediate step. I was just doing a podcast yesterday with a number. There was a few of us being interviewed at the same time, and one of the other people that was being interviewed was a professor at Stanford who studies brain and perimenopause and menopause and brain health, and like risk of Alzheimer's and dementia and things like that. And the interviewer asked us like, "What's your dream team of tests?" And she said, "Well, my dream actually starts with a really skilled history."
Hmm.
And I could not agree more. Like the story behind what is going on with an individual person, someone skillfully listening to that story, thinking of it in terms of a timeline, having some of that pattern recognition training and experience, and really just slowing down and spending 15 minutes listening to that story will guide us so much better.
Yeah. And that's the thing that's missing
Yeah.
so much of healthcare.
It really is. And so, it can be expensive to hire a coach. It can be out of pocket to hire a really skillful women's health physical therapist. But one, two, three visits with a person like that can really leverage the effectiveness of your access to the rest of this care system, whether we're talking about, your local gynecologist who's covered by your insurance or a direct consumer supplement brand. I think you can use those tools better if you have a person who's really knowledgeable to help you navigate them.
I have one doctor. He's my electrophysiologist, and he's been like the main professional that has helped me gain perspective over the health issues that I've been having and connect with the right doctors. And I reach out to him all the time, and he tells me, he's like, I'm just the electrician. I said, I know, but you listen. You're a
Yeah.
listening electrician. And he's like incredibly helpful. I mean, I went last week and it's supposed to be a 10-minute appointment, and I was there for 45 minutes. And then he sent me this big, long communication afterwards, like just documenting everything so it was in the system and the other doctors could see it as well.
Yeah.
And, I'm just so grateful for him, even though that's not what he's supposed to be doing.
Well, and I think, there are people that you can hire to do that job. Sometimes you can find someone in the system. I think within the health system, particularly if you're navigating, perimenopause, menopause, and a chronic health issue, which again is super, super common. It's 85% of the time.
Hmm.
Another real wonderful tool is if you're within a health system, utilizing the messaging to your providers,
Yeah.
because it gives you a minute to like go home, research, pull together your questions, maybe talk with your coach, talk with your physical therapist, talk with your nurse practitioner, and then send them questions, and do your best not to overwhelm them, but you can really refine that. A lot of times all we need, and I get this too all the time from my clients, like a one question email. Like,
Hmm.
just soothe my mind about, what do I do about this? Does this matter? Do I need to go down a rabbit hole? Do I need to see, do I need to go to the ER? I mean, don't ask, just call 911. Don't ask your provider that. They can't answer the question. Just call 911. But like, there is some time where we just need to have someone, as you said, listening, who has some idea what they're doing, but even more than what they're doing, how to navigate all these tools. And so while I think AI has some real promise for some of this complex research, and I'm actually encouraged by that, it's not going to replace, it might give you a suggestion, but it's only going to have the context that you've given it. And it's not going to like slow down and ask you more questions and help you get clearer. It's going to be like, okay, based on this data and like whatever I see in my algorithm, which we also don't know it's how it's been programmed.
It goes word by word.
Well, exactly. I mean, we know the tool basically just is about finding the next most common word. So it's not actually an intelligence.
No,
It's a large language model. It's about language.
yes.
But it has to be created with a bulk of information behind it. And from a medical perspective, I know this to be 100% true because I've worked with some of these tools on the backside. It only often gets the abstracts or things that are publicly available because there's been a lot of conversation about like
And a lot of that publicly available information is 10, 15 years old.
correct, or the abstract doesn't really give you the full story as the real article. It also doesn't put it in context because it might just take articles that, I don't know, from like 15 journals, not from 25 journals. So there's a lot about the back end of ChatGPT and any other LLM that is really limited and that could give you absolutely wrong information. And the other thing that AI does is it's actually all been programmed to please you. There's an
Me
aspect of
too.
it.
Yes.
Yeah. So it actually, and Donna, you and I have talked about this, it does this in marketing, but it also does this in healthcare. It
Scary.
makes stuff up.
It makes stuff up and then it hallucinates. It doesn't just make it up, it goes on a trip.
It makes it up in such a way that it seems real. And
Yeah.
that's even
Or
more scary. Like it'll say it's from this paper by this author that doesn't exist, but it sort of could. Like
it
that
could,
author has a
yeah.
similar lab and they've published similar stuff.
It's a
So,
mockumentary.
yes. So these are like things, while our conventional medical system has huge problems, 10-minute appointments,
Mm,
rushed, payment issues, hard to get appointments, difficult with access. You need someone to help you navigate that. But the person is not ChatGPT.
no, not at all.
It's a human being
Yeah.
who's
It is,
highly
yeah.
skilled.
Yeah.
Yeah.
I mean, this is one of the reasons, like in my work, I think it is so incredibly important, particularly for women over 50, that they understand the way these tools work.
Yeah.
Because this will keep us relevant for as long as we want to work if we know how they work. But if we
Yeah.
don't, if we're buying some bogus chat like custom GPT that somebody with no experience in any kind of, computer engineering or design has created and isn't maintaining and has absolutely no control over anyway, because you can't
Right. Then it
you
starts to
can't
take off
you
on its
can't
own.
have the same result twice. Like
No.
what are you putting your trust into, you know? You have to bring your own um, discernment and
Yeah.
expertise and level of knowledge to using these tools in any regard.
Yeah. Well, and so I think that's one key piece of the puzzle when it comes to perimenopause and menopause. It's probable that if you're experiencing symptoms, that it has something to do with perimenopause and menopause, and it may also have to do with other health issues that we
Mhm.
also don't want to ignore and be like, oh, that's perimenopause or whatever. That it's like the old that's anxiety or whatever.
Mhm.
So that's one piece of the puzzle. The second piece of the puzzle is, I think, as a woman in your 40s, 50s, 60s, this is a really wonderful time to revision what you want out of your life. And so that's the other thing that coaches are highly skilled at, and health coaches in particular, because we have to think about why do you need to be healthy? What kind of health? What level of commitment to the health versus to the life, because you could spend all day, every day, deep diving, taking care of your health. And sometimes that's a distraction from giving attention to your life. We want to simplify the health piece so you have the energy to do whatever it is you want. And most of us, other than perhaps when we were like 17 years old and the guidance counselor said, what do you want to be when you grow up? Didn't have hasn't had the opportunity in a long time to slow down and think about what do you want to be when you grow up.
Yeah.
And most people in their 50s who are even moderately healthy are going to live 30, 40 more years. And so maintaining and optimizing your health in this time frame is really, really important, because women, otherwise, you lose the ability to kind of what you were talking about, like be relevant, be independent, be working, be investing, be living. And you're instead dealing with a 20-year slow chronic health decline, which is a real struggle when you're trying to do anything else. So I think slowing down for a minute and looking at what parts of your life are actually contributing to a decline in your health. Do you have any control over those things? Where could you get support? You know, revisiting how you want to be spending your time and energy and what resources you have, what resources you need. Because even though people think about like, oh, save for retirement, and then at 60, you just like rest or whatever, most people don't do that. And so, and even if they did, it's really interesting. This data is almost entirely in men because women haven't really been in the workforce that long and this level. But most men over 60 who just retire and have no plan, no vision for their lives, they die within 2 years.
Yeah.
So as
That's right.
women, I think we can learn from that and be like,
Yeah,
oh,
and from my experience with having all of these interviews, um, that is so clear that women are not, they have no idea what they want because nobody cared to ask. And they didn't have the time to think about it. And when they do start to think about what they want, boy, does that change everything.
yeah. And
It really
it's
does.
actually really nourishing. What I've been finding with my clients is most of them want a little less.
Yeah, definitely less.
Yeah.
Definitely less. I like the people that I've been working with in the last couple of years, they have come to me mostly with something that they invested in that they regretted,
Mm,
which was more than they wanted. But they didn't realize that. They just thought they needed what everybody else had. But when they were given the opportunity to think about it and think about what felt comfortable to them and what felt like they were putting on a, your favorite coat or something, what they wanted was really quite simple and representative of what they're already good at.
yeah. Yeah. I think that's very true. And when you take a moment to visit that, we then realize we have a lot of levers around stress that over 6 months, a year, 2 years, we can start just letting go of.
Yeah.
Just stop doing, let your teenager do it. It's
Hmm.
going to be messy.
Yeah.
Let your 20-year-old do it. It's
They're
going to be
gonna do it
messy.
anyway. They're
They're
gonna
going
do
to
it
do it
anyway and
anyway.
lie to you.
100%. Or they're not going to do it. And the room's going to be a mess and their
Yeah.
car is going to be a mess. And so what?
Yeah, exactly. 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 I mean, when my son was little, we had a therapy fund.
Mhm.
So I was like, we can get loans for college, we can't get loans for therapy.
That's right. They're all going to need it, no matter how perfect of a parent you were. They're all going to, yeah.
But sometimes
So
I would be proactive. I'd say, okay, well, you're gonna be 35 on a couch hating me sometime. This $20 goes towards that.
that's right. That's right. Yeah. So I think that is actually really exciting from a healthcare perspective, that we are bombarded all the time with you need more of this, you need to do this, you need to be exercising this much and lifting this much and eating this perfectly and on all these medications. And sometimes you don't.
Yeah.
You just need to really revisit what are your stressors. I mean, the number of women I see who are just so much better the moment they move into a smaller place,
Hmm.
or, they work on their marriage, or they get a divorce, or they, have boundaries around their relationships with their adult children. Things like this make a huge difference to your health because chronic stress is a core driver. But if you haven't even thought about like what's really important to me, that's a really great place to work with a coach who can slow down and be like, okay, as you walk through your day, let's just journal. Like, when do I feel okay? When do I wake up feeling rested? What do I feel like when I'm on vacation, when I'm at home? Do I actually rest on vacation or am I still like running around and navigating what everyone's going to eat? You know, those questions are really important from a health standpoint because sometimes it requires a lot of sort of relearning and how we see ourselves and our identity. But when people do that, some of the more complicated layers of other things, we can make them more simple. Yes, everyone will be healthier, eating generally healthier, exercising, having, fun, good relationships. Like there are these core pillars, good quality sleep of foundational health. And stress is something not to be ignored because stress is really the driver of a lot of these things because it tells us how much time we have to spend focused on the things we actually want.
Yeah. And sometimes, like, this is what I think happens when you're below 50. There's so much going on in your life and there's so much responsibility. Even considering what you have to do to take care of yourself is stressful.
True. And so you put it off.
Yeah.
And so I think, let's say you did that. So what? Let's say you're 62 now. Start now.
Yeah.
Now is fine. And that's I think, the beauty of this. All the tools we have now are really valuable at any age. My mom is almost 80 now, and she started strength training, weightlifting. She's
Mhm.
doing great. One of my other friends who I interviewed for my podcast, Sandy Scheinbaum, she runs health coaching training as well. She's 76, I think. She's in her 70s. I forget exactly. You can go listen to that podcast. Our podcast is Integrative Women's Health Podcast. She has started like weightlifting, like free weightlifting 2 years ago. And she's in like great shape now. It's really inspiring. And she does fun stuff with her kids. She's chosen where she wants to live. Like she still is working full time. And so I think there's a lot to be learned from women over 70, over 80 who are staying really vibrant.
Yeah, we've got women in this community up to 85. It's probably 87 now because I've been saying 85 for 2 years. But
Yeah.
we have like several like mid 70s and up that are living incredible lives, doing really good work and not stopping. Like there's no exit strategy for them
Yeah.
whatsoever on anything.
Yeah, absolutely. So, if you take a moment, whatever your age is right now, and reach out to us at the Integrative Women's Health Institute, find a coach, find a nurse practitioner or a physical therapist in your area who works with women's health. Spend 1 hour to just take a breath and figure out what you want to do with your life and your health. Then we can use all these Instagrammy tools. And you might need like one. You're
Yeah.
not going to need 70. It's going to
Yeah.
save you tons of
Find a
money in the
safe
long run.
one. Find a safe one.
One safer one. Or you'll learn how to have a better conversation with your cardiologist or your gynecologist.
And listen to your
Yeah.
body in a different way.
hmm Yeah. Because you'll also have the tools to do that.
Mm.
I think it's really hard when people say, like, just do it intuitively. Like, I don't know. My body's been screaming for a decade. I don't really even hear it anymore. I've tuned it out. It's like your neighbor's dog. You just can't hear it after a while. So you need someone to help you slow down and even start listen. Like, what does listening even mean?
That's very true. That's
Yeah.
very true. Well, this has been incredible. I will put links to everything in the chat. And if you're watching on the replay and you have questions, you have comments, please tag us. We'll come back and keep the conversation going. Please reach out to Jessica. She is, I mean, I know you for, God, it's got to be 15 years.
Yeah.
And anytime anybody ever says to me they've got some weird health thing, I'm like, you can call Jessica.
That's right. That's right. I'm good with all the Weird Al stuff. Oh, excellent.
But this has been so incredibly helpful. I was just a fly on the wall because you were on a rant and sharing incredibly important stuff that people need to know, women need to know, and women that support people that support the women in their lives need to know, because like if women are not understanding what's happening in their own bodies, how are um, other gendered people in their
Yeah,
in their sphere going to understand it, you know? So I think it's important for everybody to know this.
absolutely. Well, thank you so much. It's been my pleasure.
And we will be back again next Wednesday with more. Have a great Wednesday, everybody. And thank you again, Jessica.
Thank you.